Nursing diagnosis, we have first one is risk for infection related to decreased leukocyte function and circulatory changes due to high glucose levels as evidenced by delayed wound healing. Goals for this diagnosis are to have the patient verbalize understanding of identified risk factors. They will identify important interventions in reducing risk for infection, and patients will monitor the timely wound healing free from purulent discharge and necrosis. Interventions are going to be to educate the patient on proper hand hygiene, cough etiquette, inform them to avoid crowded places when they're feeling ill. It's important to instruct these patients to monitor their blood glucose strictly and to maintain a strict glucose control when they have symptoms of illness. We're also going to educate the patient on properly monitoring their feet and their hygiene of their feet as well. Teach the patient to check the feet every day, making sure that they're cutting their toenails straight across so there's no rigid edges, and to scrub calluses off gently. It would be in their best interest for them to consult a podiatrist for continued follow-up care. And then we're also going to educate them on signs and symptoms of infection such as fever, redness, drainage, and chills, and to monitor the progress of infection if there is an infection that's occurring. Our second diagnosis is a risk for unstable blood sugar related to destruction of the beta cells with decreased insulin secretion, which would be for type 1, or insulin resistance associated with chronic hyperglycemia for patients with type 2. The goals would be to have the patient glucose reading to be less than 180, a fasting glucose level of less than 140, and to maintain a hemoglobin A1C under 7%. Next goal would be the patient is to properly demonstrate glucose monitoring and insulin injection techniques. Interventions for this goal would be the patient is going to be educated on the proper home glucose monitoring, instruct patients on proper preparation and administration of insulin. So we want to teach them how to inject properly using aseptic technique, rotating injection sites, as well as insulin storage. We're also going to be educating patients on signs and symptoms of hyperglycemia and hypoglycemia, and then evaluate their understanding. Lastly, educate patients on proper nutrition and diet, and have a patient consult a dietitian to assess for knowledge deficit and to increase their knowledge on how to give their insulin properly, as well as count their carbohydrates.